Hi and welcome. I'm trying to learn medicine. Today, cirrhosis of the liver. And after which, we're going to do a bit standing yoga. And if you participate in the standing yoga, it's an arm risk. And we're talking about a disease and internal anatomy and stuff like that. But this is no medical advice. We're just reading about it. Cirrhosis of the liver. That is a chronic disease often associated with drinking alcohol. And it is nobly fissured tissue, like scar tissue, replaces the cells as they become damaged. Okay, cirrhosis of the liver, it is associated with drinking alcohol, and by that, basically the liver becomes scarred, as the skin does it if it's damaged. If a disease can be stopped in time, the undamaged liver can regenerate itself back to a normal state. Cirrhosis is more common in men with normal symptoms, with symptoms usually appearing in the 30s and becoming severe in the 40s. Okay, it's more common in men, and it starts in the 30s and becomes more common in the 40s. Symptoms. Sometimes there are no obvious symptoms, and patients can look and feel well after the disorder has begun. Okay, there can be no symptoms. There can be also, but there can be a pale, slightly dirty complexion is common. What do you mean by that? Do we mean how the person is dressing? Weakness and feeling ill. Okay, the person can feel weak and ill. What do you think? If the liver has any cause of it? Anemia. Seht ihr what it is? Anemia, a reduction in the quantity of oxygen carrying hemoglobin. Can't be done with anemia. It would be better if that word would make sense, and these words are not randomly. Say anemia, reduction in the quantity of oxygen carrying hemoglobin. Anemia. It starts with an A, so it's Greek. If something is not, anemia. I don't know. Anemia, hemoglobin reduction. Okay, there can be anemia, so reduction in hemoglobin carrying cells, whatever it was. Tingling and numbness in feet and fingers. They can be a sign of cirrhosis of the liver. What do you think why? Small blood vessels, spider nervosis, show on the skin. Small blood vessels show on the skin. But all because the liver is damaged. In men, the breasts may swell as the diseased liver cannot inactivate the female hormones that are present to a small degree in all men. Okay, the liver can send out things to repress the hormones that mostly associated with women having them, and now the men do not inactivating them, and they have them, and so the breast get larger. Atrophy, that is shrinking of the testicles. Now we're talking also about this stuff here. And also loss of sex drive, and loss of appetite, and loss of weight. Duration. Cirrhosis caused by alcohol lasts until the patient stops drinking alcohol together. If no complications arise within about a year and a half after abstaining, a normal life without drink can be enjoyed. Okay, that means if a person stops to drink and does not start to drink again, a normal life can be lived on. If a patient does not stop drinking, liver destruction continues and death will eventually follow. Causes. Alcohol is the cause of the majority of cases. Alcohol also aggravates cirrhosis from other causes. Chemical damage from anesthetics, cleaning fluids, and some drugs. I don't really know what anesthetics is. I heard the word a couple of times, I don't know what it is. Virus hepatitis B can also cause it, and cirrhosis less commonly follows heart failure. Obstruction of bile ducts and poisoning of liver cells by other substances and infections. Okay, it can come after heart failure, after the bile ducts are obstructed, wherever they are, and the liver can be poisoned. It can happen through substances or infections, what do you think? Infections. Complications. Piles. Is what a disease? Piles, pills, piles. Internal hemorrhage from the esophagus. I don't really know what a hemorrhage is, but it doesn't sound good. Internal hemorrhage from the esophagus. I have a suspicion what it is. Ascites. That is a buildup of fluid in the abdomen. Cancer of the liver. Treatment in the home. Cancer of the liver. What was it again? Normally tissue like scar tissue replaces the cells as they become damaged. And why is it happening? But why is alcohol doing it? Okay. And your treatment in the home. Non-advised, consult a doctor. When to consult a doctor? If drinking is heavy, or there is danger from exposure to industrial solvents. So we're saying every time if someone is drinking heavy, they should consult a doctor. But again, this is not medical passages. What the doctor might if the above symptoms suggest the disease, and if the symptoms suggesting the disease symptoms were maybe less than no symptoms, a pale, slightly dirty complexion, or do they mean a facial expression or weakness, feeling ill, anemia, and bit force, a reduction of blood carrying oxygen cells, tingling and numbness of feet, small blood vessels, spinal vasa, and also atrophy and decreased libido and less appetite. What the doctor might do, take blood tests to determine the amount of liver damage. It is possible to see at blood tests. Because the liver is an organ. How is it now enough to test the blood? And to identify the cause, it is other than alcohol. Yes, to look at the cause other than alcohol, refer the patient to a special physician, psychiatrist, or alcoholics, or alcoholic support group, depending upon the cause. Are there alcoholists? There's so many people who do it as medical as a profession. We advise the patient to give up alcohol to prevent further liver damage and suggest a nourishing vitamin-rich diet and rest. Prevention. Avoid too much alcohol or contact with other potential liver poisons. See alcoholism. Prevention also get medical help if you are a heavy drinker. Now it was a part to cirrhosis of the liver. Can other things also have cirrhosis? Because if yes, then the word cirrhosis would mean something. The word cirrhosis just sounds like erosion. It sounds like the liver gets erosion and the skin, the liver becomes scarred. So that would make sense if it comes from it. But we're going to read on, find out, and then I'm going to say. That was for part 2, cirrhosis of the liver. If you were here for cirrhosis of the liver to talk about it, then you can go directly to the next part of medicine. We will do now the standing yoga. If you participate in standing yoga, that's better to ask. We're having your feet standing together and you're breathing in and lifting your arms up. And breathe out, bring the arms down. In and the arms up. Out the arms down. Again in the arms up. Out the arms down. And the next exercise. Breathe in the arms up. And breathe out open to the side. Breathe in the arms up. Out open to the other side. And lift the arms up. Make an ear space between the feet and open to one side. Breathe in the middle. And out we go and halfway down. And go up. Out open to the other side. In. Out and down. In and up again. And out the arms down and we're leaning onto our knees. And now we're doing standing cat and cow. Breathe in. And out, make a belly with a bagel cat. Breathe in. And out. Now the belly with a bagel cow. Breathe in. And out the hill with a bagel cat. Breathe in into the middle. Breathe in, so little. Open the cup of a pick up. And a backward shoulder up. Breathe again in, lift the arms up. Hold open to the side. Again in the arms up. And out bring the arms over the sides down, becoming down into the chair. Breathe again in, come up. Halfway. Higher. And out. And coming up. Breathe in and reach high. And breathe out open to one side. Breathe in, lift the arms up. And out we going down into the chair. Breathe in, come halfway up. Higher up. And out. And now breathe in and come up onto tiptoes. And breathe out and we're sinking down. Breathe in and come up again. And breathe out again down. And without time up. And out we do a down diving dolphin. The arms come over the sides down, long legs, straight legs, and get up. And now for a moment, breathe in, bend the right leg. And breathe out and stretch left leg. Breathe in and change. And out and stretch the right leg. In and change. And out and stretch left leg. In and change. Out and stretch the right leg. In and change. And out and stretch left leg. Again. And out leg straight. And now, the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look up the right shoulder to the right hand. Breathe in, inhale down. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left. Breathe in, head down. Out and down. Now the pelican, make a hand with space between the feet, shift the weight to the heels, and breathe in and down. And breathe out and up again. And again in and down. And out and up. Now take hold of the elbows, and gently rock from side to side. Again the hands down, feet together, and breathe in, come half air. Straight back, and breathe out and go down again. Breathe in and get half air, and out and down. Now we're going to come up. And hands down. Now the legs stand wide apart. Breathing in. Not wide apart, shoulder, elbow, and elbow wide apart. Breathing in, the arms up. And out and we're sinking down. Place the elbows against the inside of the knees. And now again. And out and cover the back up. Breathe again in. And out into the garden pose. Now you can do this again. Now you do another exercise. Breathe again in. Out, either you come back or out you come up in one straight line. And breathe again in. And out, come back into the garden pose. And we're doing that again. Breathe again in. And out, go either back or up. Tuck the pelvis in, come with the crown of the head first up. And down. And one more round, breathe in, the arms up. And out and down. And the last time, breathe in. And out, we're coming in one straight line up. And we're up. And we're up again. So come on. And we're ending. Have the feet standing together. Breathe in, lift the arms up. And breathe out, go back, draw the shoulder blades together. In and up. Out and back again. In and up. Hands together, breathe out, lean back. In and up. Out and back. In and up. Out into the side. In and up. Out into the other side. In and up, across the arms and the 20 fingers. Breathe and reach high. Breathe out, reach the front of the back. Breathe in into the middle. Out across the other way down. Breathe in, reach high. Reach front of the back. Move into the middle. Out, lean back, arms long. Again, in into the middle. Out, the arms down. Move into the arms up. Remain to touch the lower hands down to heart center. It was a standing yoga. I thank you very much, and until next time.